It was this bush here where I was. Yeah. So, you know, and the rats used to come over here and climb under the bush and bit my foot really, and I was in a bad way then, and I had to go in hospital, and you know, so that was my experience of being homeless.
My journey started from a young age with mental health. I was not like everybody else. I'm completely different. I act differently, I think differently. And growing up, it was hard.
When you're in the thick of it and you're waking up behind a shop or in a doorway, it's not the best start of the day.
My story is over 20 years in active addiction, drug and alcohol dependent. I used to use needles, heroin and crack were my drugs of choice. Yeah, drugs got hold of me very quickly. You know, I started using drugs and very quickly they started using me. And yeah, it just went into a life of crime, throwing away a career, and everything that comes with active addiction, you know. And I caught Hep C through sharing dirty needles. Yeah, I got a 13-year jail sentence for drug offences, spent a couple of years street homeless, living in Birmingham on a car park, shoplifting every day, you know, and it was quite dark, very isolated, very alone, a lot of hatred of self, you know, what have I become? You know, I knew right and wrong growing up, I was brought up very well, and I just ended in a place of just no hope and really very, very dark and alone. You know, it wasn't a very, you know, I didn't want to live, too scared to die, you know, and that's where it sort of took me.
So I was just labelled a naughty child. I was unmedicated. My family couldn't deal with me. People around me couldn't deal with me. I've never been able to hold relationships, as in boyfriends and everything else, because of my mental health. And at one point, my mental health was that low, I couldn't even say my name. My son is autistic and ADHD, and as I was taking him through to CAMS, they said, let me test you. So they tested me, and he went, how have you coped? He went, how have you got so far? And I said, with extreme difficulty. Every little task to somebody else, making a cup of tea, is a big challenge to me, especially if my mental health is not well. You know, every day I'm struggling. I get judged a lot by it. People look at me, you know, there's nothing wrong with her. Look at her. Mate, if only you could get into my brain for the day.
You always get this look of a homeless person that they seem just drawn and you know, drained, and that's what it does to you. It's just because every day is a constant battle. Food, shelter, warmth, you know, and unless you've got somebody like an organisation like the Good Shepherd behind you, you're not going to make it. You're not going to do it out there on your own, because it's just, and this is another thing about the street, it's dog eat dog out there. You'd think you'd find compassion. This is the only place you're going to find compassion. It's not out there on the street. We've got to go up that big hill now, John, this. Back for the 10th time, isn't it? Yeah. So how was your morning today?
Okay, yeah.
And you,
Dodged the rain, like.
yeah. And you came at your place and just...
Yeah, I've been up here since 5:45 this morning, like.
And where have you been this week? Where have you been?
Go to Maryhill, like.
You went to Maryhill?
And go to Newbridge as well.
Yeah. That's such a difference, John, isn't it? From the old days, isn't it?
Yeah.
Wow.
At the time I was on the street, homeless, and,
Yeah.
you know.
What put you in that position to begin with? What?
To be honest, it's probably like when I lost my flat and on the street, like,
Yeah.
so.
And again, life's a struggle for everybody, isn't it? It's a struggle daily, isn't it?
Yeah,
I mean, so for all of us, so for you just to fit back into the community, that's just been spectacular.
That's
And,
right,
and again, you've got access to doctors now and dentists and...
Like I said, I have a CPN, like, as
Yeah.
well. I see once a month, like, just
Yeah,
to see how I'm doing and that. Like.
yeah. And you're
Yeah.
happy with that?
Yeah, I'm okay.
That's enough,
with
yeah?
that, yeah.
So what would happen, do you remember? Because on a night time, you'd only be allowed to stay until you couldn't go back out up till 10 o'clock.
That's right, yeah.
So once you was in there, you'd want to smoke again after 10 o'clock.
Right.
So you'd get up and you'd come out. But once you was out, we couldn't let you back in again.
That's
So
right.
then you'd come out into this bush here. Do you remember it? There, that's exactly where you used to sleep, in that
not
bit
right
there.
over there.
Yeah?
Right. Yeah, so,
So you'd come out and get in here,
right.
and I'd come out and this would be full of rats, and I'd try and wake you up and ask you to get up, and you wouldn't. I remember the morning we came back and you'd been bitten,
That's
and
right,
I remember finding you and your head was oblong, like a real. We'd found the ambulance, but unfortunately the ambulance wouldn't take you because you were saying what you didn't want to go.
I mean, that was the day on my birthday.
I think it was, John, yeah, I think it was.
Because he came and
Yeah.
tried to get me out.
Tried to get you out the bush, wouldn't it?
Someone's mum moved.
Yeah.
I couldn't really move, like, because, you know,
Yeah.
because the rats did my
Yeah,
foot, like, you know, sort of thing.
Yeah.
Like I said, if it wasn't for the night shot to snap on,
Yeah,
I wouldn't be here now, like.
No, John, no.
Because I was taking the number and couldn't move or do anything, like, so, you know, until Katie came and saw me in the bush, like,
Yeah.
like, you know, so.
What worked for you? What was the changing point, John? What was the actual changing point for you?
Coming back to you guys, like, at the Good Shepherd.
Yeah.
uh,
And just getting the support, and then getting the accommodation, and just moving on, and your medication, getting your medication right as well.
Right,
Yeah.
I think a lot of time people from inclusion health groups are excluded subconsciously or unconsciously by services by the way that they're designed. A service will make an assumption about a person that they've got an address to send a letter to, or they've got a mobile phone that they can be contacted on. And it's these additional barriers that are put in place for people to access who are homeless that services don't even really consider. Also, I think there's a lot of stigma and negative past experiences that people who are homeless have of going to hospital, going to the doctors, to treatment services, and those past negative experiences just can make them a bit more, I don't know, we tend to find a lot of people accessing the Good Shepherd will end up delaying things, not going to see the GP, not accessing primary or secondary care, and going straight to accessing emergency care, just putting off for managing their health, whether that's physical or mental health. Obviously that ends up with much sort of greater impact to the person's health, poorer health outcomes for the patient, and also a higher cost to the NHS and services.
Part of the treatment I was going through is every 2 weeks I had to go for bloods. Now you can't get blood out of me because I've got no veins. You know, I've smashed myself to pieces. Even now, many years later, you still can't get bloods out of me because I've done that much damage to my veins. And every 2 weeks they'd come and get me and take me to hospital, and I'd say, please don't take me. You can't get blood out of me. You know, I've got no veins. And they make me go to the hospital. They sit me there. Their nurses would have about 20 goes in each arm, treat me like a pincushion, and it hurt. And then they'd start tutting at me and they make me feel this big, you know, and that was not a very nice experience. And what really upset me is I told them beforehand they wouldn't be able to do it, yet they did it anyway, you know. So I believe what we need to do is start listening to the client base. Do you know what I mean? I weren't saying it for jokes. You know, I knew it weren't happening, but they did it anyway. A lot of the people I work with today have had these same experiences, you know. They go into hospitals, they get treated poorly, you know, whether they mean to or not, you know. I mean, people can have big ulcers in their legs or whatever, and it does create a smell, you know. And I've walked in with a patient before with this same problem, and then a nurse will shout out, oh my God, what's that smell? You know, making the person feel even more, how can I say, feeling even worse than he does already, because he knows it smells, you know. So, yeah, and a lot of people I work with have had this same experience with the healthcare. So a lot of them don't want to go to hospitals, you know. They really don't.
Throughout my time being homeless, there was a lot of times I had medical issues, so I had to go to the local hospital. I think only because I was homeless and I didn't have an address, I was treated different. I'd say I was treated a little less respectful than other people, but I guess that's part and parcel of you know, it's the whole kit and caboodle of being homeless.
A lot of the stuff that we do is try to remove some of the barriers for people who are accessing our services. So trying to make it as easy as possible for them to get to appointments, or the kind of gold standard for us is bringing services here to the Good Shepherd. So we've worked with a wide range of health partners across the city to bring in things like the opticians, the specialist dental team, TB nurses, the Hep C clinics, sexual health screening. We did a lot of work around COVID as well with COVID vaccinations, and we've got an upcoming event around cancer screening. So for us, bringing agencies on site, we can say to that person, you might have had negative experiences in the past, but come and see someone here in a place you feel safe, positive environment. We can introduce you to the worker, and we can remove some of those barriers to engagement.
In their job role, some people are born for it, some people aren't, and the key is you've got to enjoy your job. You've got to enjoy what you do, and that makes such a difference. You know, if someone in the hospital, you know, there was one nurse and she was just no smile, anything, and I know that might have just been her face, but in that industry you can't work like that, because as I was at my lowest, I needed that someone to just be like reassuring, like, you know, it's okay to not be okay. It's okay to feel the way you do. And I didn't get a lot of that. There was only a few couple who did. And, you know, these nurses that took the time and was playing pool with the clients, that, you know, we're doing groups with the clients. Them are the positive people that will make a difference, because all that 5 minutes of listening, that's all it is. And, you know, and people don't, like myself, don't need to just be told, okay, no, okay, so how does that feel? I don't understand, I've not been through that, but, you know, how can I help you?
I've been on wards, and some of the things I hear, they make your toes curl, you know, about our certain client base, you know, and but there are some people who really do understand. You know, these people have been through it. You should never judge them. You've never walked in their shoes, you know, until you actually get down and start talking to them. And I love that. A lot of times they don't get listened. Nobody listens to them. They get talked at. Do you know what I mean? A lot of the time, all they want is a little ear, you know. So when you've got a nurse who's loving, caring, compassionate, sits down, asks how they are, sits there and listens, actively listens, you know, and means it. It means the world to the patient.
One, we are all individuals. We may have one thing in common, whereas we're living on the fringes of society, or some people do. But I would say, just treat everybody with the same amount of respect and decency that they deserve, because every person's got some story, or could be issues, mental issues. They've got some reason why they're in the position that they're in.
Things are changing, you know, and they are getting better, but it just takes time. You know, I mean, we've had patients who missed appointments. You know, there's no thought about where this patient lives or how they're going to get to the hospital, but they've been given an appointment by the hospital to come in to see the nurses. And these couple of people I'm thinking about now, you know, they live 2 bus rides away, they're street homeless and got no money. They miss an appointment. Next thing you know, they're sending out letters. The letters sort of read, you know, you've wasted my time, you've wasted NHS money, you need to make better decisions. Imagine if you got a letter like that from the hospital. Would that want you to come back and engage with an hospital? No. You know, so we sort of had to sort out what letter, we sort of had to stop all that, because that shocked me. You know, I mean, would you send that to a cancer patient? No, you wouldn't. You know, you really wouldn't. And so now the letters sort of state, you know, we know you missed your appointments, you know, is there any way we can support you in getting to the appointments? You know, we're here for you when you're ready.
By working together and addressing it at the earliest stage, we get the best health outcomes for the patient, we reduce waste and cost to the NHS, and it also creates that partnership work between third sector, lived experience and the healthcare system. And I think that's absolutely invaluable for those reasons.